To help celebrate this 50th anniversary of our society, our program committee elected to interview the charter members of the Cushing Society, and has given us the privilege of interviewing Dr. German. I think that we're particularly fortunate in having Dr. Davy as an interviewer, because he has not only been one of the early residents of Dr. German, as I was, but he's been associated with him in the practice of neurosurgery for his whole professional career. And furthermore, that's one reason, but the second reason is that Dr. Davy, as an undergraduate at Yale, because of his linguistic abilities, was selected by Dr. Cushing as his bursary student to help him in his library. And I think it would be appropriate, Bill Davy, if you would just tell us a few words now about this fortunate setting that we have today.
Just before Harvey Cushing died, he wanted to give his books to Yale, but was having difficulty in getting a commitment from Yale to build a library. And finally, he offered them a reasonable ultimatum. If they didn't build a suitable place for the books, he would have two other alternatives. One was to give the books to some other institution, or to put them on the market and let young men who might be interested in bibliography have the opportunity to start their own collections. It did not take long for the Yale Corporation to make the right decision, and this library was built. It is built in the form of a Y, with one of the wings being the regular medical library, and this wing being the historical medical library. It was designed by Grosvenor Atterbury, who was a classmate of Harvey Cushing's, and the main library is entered through a rotunda in which there are located on the walls the insignia of 14 of the various universities that gave him honorary degrees. He had a total of 24 honorary degrees. In the center of this group of insignia is a dedicatory plaque from his classmates, because of the classmates of the class of 1891, of whom Grosvenor Atterbury, the architect, was one, who donated the rotunda.
Could I interrupt just for a moment? I think Grosvenor Atterbury was also president of the Pennsylvania Railroad, but not at the time he was an undergraduate. Some people thought they had undergraduates running the railroad, I'm sure.
Well, that might account for the reason that the library went up as fast as it did. One of the interesting things about the library was that because Dr. Cushing had so many incunabula and some very rare books, he wanted the library to be built with adequate air conditioning to protect these books. And this library, when it was built in 1941, was well ahead of its time. Also, it came in June of 1941, just before Pearl Harbor Day. Had it come just a few months later, the library would not have been built. They could not have obtained the steel. They were just fortunate. And sad to say, Dr. Cushing had his heart attack only a matter of a few days after he received the news that the Yale Corporation had agreed to build the library, and he died a few days later.
I think perhaps we'd take this opportunity to introduce our charter member, Dr. German. I think all neurosurgical chiefs are held in respect and admired by their students, but I'm sure that there's none that are so beloved as Dr. German has been, and not only by his residents, but by everybody he's associated with. And this kindness is certainly very well known and has been shown by the things that have happened. I'd like to give a little anecdote of how this kindness affected me. When I first started my training with Dr. German, the time came for me to do my first ventriculogram, and I was in the operating room with this pistol grip cable burr that was dull, and I kept going into this right parietal region and pressing, and time went on, and I wasn't getting through, so I gave more and more pressure, and of course I plunged. And with cortex over the hands and face, I trembling, I said, "Call Dr. German." And of course, Dr. German came up while I was thinking of what train I could get out of New Haven. He walked in, and he took his mask, and he looked in, and he said, "Well, this is very interesting. This is not bleeding." And he turned and walked out of the room, and as he left, he said, "Remember, Ben, you have to put one in on the other side as well." I think the world lost a very mediocre dermatologist. I don't know. But this, to me, it typifies, and we could give you dozens of instances of how this has similar occasions that have taken place with all the residents. And for a brief bibliography of Dr. German, he was born just barely caught into the last century in fall of 99. And at the age of 10, his family moved to California, and he went to University of California, where he was a good swimmer. He swam for Cal. And then he got his A.B., and he stayed on, took his master's there, and was instructing physiology. And he transferred to Harvard Medical School. Where
Before you get too far along, I'd like to make a correction. I wasn't a good swimmer, and I was a diver, not a swimmer.
Oh, excuse me. But you're on the swimming team.
Yeah.
On the swimming
That's
team.
right.
And he went to Harvard, transferred to Harvard Medical School, where 3 years later he graduated magna cum laude, and then took an internship under Dr. Cushing, the surgical service at the Peter Brent Brigham. And following this, he had a Rockefeller Fellowship to Johns Hopkins for plastic surgery, and then came back to work with Dr. Harvey with a William Harvey Cushing Fellowship in surgery, and took his residency in surgery and neurosurgery at New Haven. And from 1933 to 1968, for 35 years, he served as chief of the department in neurosurgery at Yale, and was this entire time was the sole. He became professor in 48, I believe.
I think so,
professor in
yes.
48.
Yes, that's right.
And his, of course, his military service, he got in on World War I a little bit, so he has a string of fogies that goes up one arm and down the other, and then went into World War II, but...
That's not correct.
It wasn't correct? But you would. Did you go into World War I?
Yes, but I was only in 3 months.
That's what I meant. You get tagged on. At any rate, he's always had a lovely family, and when he was at Boston, he fell in love with Dr. Cushing's scrub nurse, Helen Whipple, and it turned out she cared more for Dr. German than she did for Dr. Cushing, and they were married.
That was a great mistake on her part, because...
Well, some people have questions.
Yes.
But anyway, they had 2 lovely boys, and John has gone on and was one of Dr. German's last residents and is practicing neurosurgeon in New London, Connecticut today. And then Mrs. German died, and after the war, he married Dorothea Fisher, whom we all knew as his very efficient secretary, and they had 2 children.
Yeah, a boy and a girl.
Boy and a girl.
Uh-huh.
And I think to mention some of the honors that Dr. German has had, of course, he's been president of this society, and he was president of the Senior Society of Neurosurgeons. He's been president of local neurosurgical societies, and he was secretary of the American Board of Neurosurgery. And of course, he's had most any honors you can think of AOA and Sigma Psi, and actually, it's very befitting for a professor at Yale, I think. And
That's one of the rewards that is given by universities in lieu of a salary raise.
Yes, I think that's probably so, and maybe quite typical of Yale. Right?
Yes.
I don't know. Well, anyway, when we asked Dr. German for this interview, he said, let me go through some of my old papers. And so did he ever hit the jackpot? Having been a historian of this society, he came up with some papers, and I'd like to have you tell us something about these, Dr. German, and the significance of them.
Yes. These are the papers that cover the first year and a half, approximately, of the organizational phase of the Harvey Cushing Society, which went from 1931 pretty well into 1932, approximately a year and a half. And they were, for the most part, buried deep in Louise Eisenhardt's archives, and that, in turn, was in her apartment, which was over on the other side of town, and that's the reason we didn't get to it very often. Transportation was poor. And Louise was the secretary of the Harvey Cushing Society, I might say forever, except for 1 year that I was, I think. And she kept a very good touch on things. In fact, somewhere I have a little book that is the recordings of her minutes of the various meetings during the first, I think it's approximately 10 years of the Harvey Cushing Society. And we'll show you that later on. Louise Eisenhardt should be depicted in a photograph sometime during this filming, because it certainly is not fitting to go ahead with any recitation of the Harvey Cushing Society's ways and won'ts without early tribute to her. She is probably the string that tied the whole thing together.
The sweetheart of all neurosurgeons.
Oh, yes.
Yeah.
Now, actually, the organizers of the society were two, and they were both Harvard men, the class of 1923. So they were 3 years ahead of my class of 26. One was Glenn Sperling, and the other was, what's his name?
Bill Van Wagenen? Tracy Putnam?
Yes, Van Wagenen. Yeah, we called him Van. And so when you said Bill, it kind of threw me off for a moment. Yeah. They were classmates of each other. And how they got together exactly to plot this deed of forming another society to, so to speak, undercut what we now call the Senior Society is not entirely clear, except that there's a letter from Glenn Sperling to Van Wagenen to the effect that there had been a meeting in Washington at which they were both present, and they had talked about the advisability of forming a new society to cover somewhat junior members of the neurosurgical communities. So they went on from there, and they had innumerable correspondences. And many of them we have, and we'll read samples to you. And at least I think either Bill or Ben will read them, because that light is so bright I don't think I could read anything. Anyway, the point was that we had to weed out a great many letters, which started out something like, "Thank you for your letter of so-and-so, which I received on a certain date. And I was glad to hear that you had talked to so-and-so." And it goes on from there. So it doesn't really give too much information as to what the society was thought to be about. And it was just a thought in the mind of two men, really, that put this thing on wheels.
Glenn Sperling was kind of an aggressive guy anyway, wasn't he? I worked with him at Walter Reed during the war. We always used to say, what Sperling wants, Sperling gets.
Yeah.
He would seem to hang on like a terrier.
Well, yes, but I think you said, one of you said the other day, that he was very gentle at the same time in his correspondence. And he would never slap anybody, so to speak, in the face, you know, figuratively. he always had a way of coming around and say, well, don't you think it might be a little bit better? It might be, rather than saying that it would be.
Certainly his letters would sort of adapt themselves to the tone necessary
Right.
to appeal
Yeah.
to the individual to whom he was writing. And I was very much impressed with the singleness of purpose with which he pursued the idea of forming this new society. And as Ben said, he was the kind of man that if you knocked him down on one side, he'd come up on the other.
His
And
route
this
may
is,
be circuitous, but he would hang on to his goal.
Yes.
it certainly reflected clearly in his letters that he was really one-minded about forming the society.
It might be of interest when we're going through the photographs later on to point him out in that first picture of the society. So you'll see who Glenn Sperling was, because maybe many of the present members who didn't know him at all.
Yes, I have a fine photograph I think perhaps we can show.
Yes. And
In here.
also of Van Wagenen. Now, to identify them just a little bit more, Glenn Sperling came from Louisville, and he was dyed-in-the-wool Southerner, I imagine a Democrat, you know. That's why the fact that I hate to say it. Van Wagenen was from Upper New York State, and he went to medical school at Harvard, and then he transferred his activities pretty much to Rochester, New York. And I suspect he's a Republican. Now, not that this makes so much difference, because at the present time, I think it's quite possible we'll have a change of administration. And in that case, maybe some of the so-called, what is the word they use for those who attain their position by means of political influence?
That's very true. I think there was one neurosurgeon, when they're writing back and forth as to who should come in, they had a question about that. I think you covered that, Bill. What was that?
Well, one of these men seemed to be a pretty feisty sort of guy and had some definite opinions about various people. And he wrote of one man that wasn't sure that we ought to take him in because he didn't do any reading except for dime novels and held his job only by political pull.
We don't want this man in the society.
Right.
Some years before he got in, I guess.
Well, there was another term, and that was grantsmanship, that tended to lead to promotion in universities. And if you got a good grant from the federal government, it didn't make too much difference how you spent it, as long as you got through spending it by the end of the year, and then they could ask for another one. So I might say there that the university, I believe, reaped about 25% of the government grants that were given to professional and other schools of the university. So it was quite to their benefit to have grantsmen on the faculty. I was never a grantsman.
But you had plenty of other qualities to hang in there.
Well, maybe I did, but I'm not sorry I wasn't a grantsman, incidentally.
That's right.
Now, I'll let you have the floor for a while, Ben.
I think it'd be well now to read some of these very interesting papers that Dr. German has, and to give the membership an idea of some of the reactions of the originators in this, and it wasn't easy to just start a society. And you have some of those early letters, Dr. German. Would you want to read one?
I'd like to very much. First off, I'd like to put it in its proper setting just a little bit more, and that has to do with the fact that Louise Eisenhart died before we knew of the existence of these letters. My then associate, Steve Flanagan, went over to tidy things up in her apartment a little bit, and he found this wealth of material in letter form, and he brought it over, and it is all down in my basement now. Copies and copies and copies of the minutes of the Harvey Cushing Society extending for 50 years, almost 50 years now, and of various letters that are pertinent to the organization and the carrying out of the society. Now, this particular letter was written to Van Wagenen. Van Wagenen does have a first name. It's William, incidentally, but he was always called Van, so the letters usually started out, Dear Van.
This is from Sperling?
From the Sperling, yes. So that I think we can say that Sperling was the father of the Harvey Cushing Society, and that Van Wagenen was his stepfather.
For the sake of historical perspective, the date of that letter is June 24, 1931.
Right. Now it starts out, Dear Van, I'm sorry to have missed you at the neurosurgical meeting. We had a very nice time. Now apparently that meeting was in Washington. I'm filling in there. I am writing you primarily at this time to get your reaction about the formation of another neurosurgical society. In the beginning, I should say that it is not a question of my desire for membership in the present neurosurgical society because, as a matter of fact, I have been invited to most of the meetings recently and have every reason to expect that eventually excuse me, I will be elected to membership. I do feel, however, that there is a distinct place for another society, and if it could be organized properly, I think I would be willing to throw my lot with it. Now, I think that that is very important because, in other words, he is in a way giving up his most cherished desire to belong to the senior society if that should become necessary.
Yeah. You're really dedicated.
Yes, absolutely. Now that is what's his name?
Sperling's?
Yeah. You see, I'll keep asking you.
Okay.
Just make sure that you're awake. The present society, and he's speaking here under the title Present Society of the Society of Neurological Surgeons. And I might just give a little aside here at this time. Back in the 1930s, the Society of Neurological Surgeons were asked by the British Neurosurgical Society if they would be good enough to change their name, in other words, the American group, to the American Society of Neurological Surgeons. And the letter came back. It wasn't very long, and it didn't take long to catch the point either. It said, we are the Society of Neurological Surgeons. They wanted everybody to know that.
Did that come from Cushing or Fraser? Or
No, I don't know who it came from. But, no, Cushing was gone, I think. Yeah. Well, anyway, here we go now. This is the next paragraph. The present society, now that, by the present society, he refers to what is known as the Society of Neurological Surgeons, has only about 2 vacancies left, and that will bring their membership up to 35. 35 was the prescribed limit of membership, the upper limit of membership for the senior society, and you can tell why they call it the senior society. If they get beyond that number, the society will lose much of its charm and usefulness because, as you undoubtedly realize, a small society is far more desirable from every point of view. Now, of course, there are a number of ways to take this, and one might say, well, of course, if they have only the ones that were elected to the society 50 years ago, they won't recognize each other, which is about the situation I'm in now with respect to the Harvey Cushing Society. At any rate, assuming that to be the case, there are, I figure, about 20 men who are doing neurosurgery exclusively and are doing a good job of it, who will not be included in the membership of the old society for many years to come. To put the record straight, I might say that at this time, 1931, I was not limiting my work to neurological surgery. I was also doing my share of general surgery at the Yale Medical School. And we all had to take a turn in general surgery, and then the rest of the year we spent in our particular favorite form of surgery. And I might also say that Dr. Cushing continued to do general surgery after he left the Hopkins and went to Brigham. And a good many, Fraser, for example, continued to do thyroid surgery for as long as he did active practice. So it isn't anything that's necessarily a fine act on the part of the actee to give up general surgery. I think it may be a good idea to have a little go at it once in a while. See just how good you are compared to those guys.
I've heard Barnes Woodall say that too.
Yeah. Incidentally, would you like to identify Barnes Woodall? Because he was one of the early leading lights of our own society.
Yes, he was one of the early men after the founders, coming from Hopkins.
Barnes Woodall was the last dean that I know of at Duke, but I imagine he's been replaced by someone else now.
Yeah.
He was about 3 years younger than I, and he was a strong Maine man.
Right.
Bon Beato.
He said, Woodall said he was born in Rockport, Maine, and I said, well, great. How old were you when you left? He said, well, I left when I got old enough to know better. And I told her that, and he said, 9 months.
It's interesting, too, that what I didn't know until very recently was that he and his wife were born on the same day in the same year.
Right.
Yeah.
And what is appropriate to this, I don't know as you know, that Barnes Woodall was an expert diver, same as William J. German.
Oh, really?
Yes.
I didn't know that.
Yes.
No. Uh-huh. Yeah.
He gave a wonderful exhibition at Walter Reed one day,
Oh,
even
great.
in those days.
Uh-huh. Well, here we go now. Dive into this. I have just jotted down hurriedly the following names as being desirable material on which to start. And here we go. There are 16 names in this list, I might say. And then there are 2 more at the end. And somewhere I have a list that contains 20 names. So there are various versions of this list. But as it stands here, the first name given and listed here is Tracy Putnam, followed by Walter Dandy. See, they're aiming high. Followed by Temple Fay and Jim Gardner of the Cleveland Clinic, Sims of Memphis, Schreiber of Detroit, Clemmy of St. Louis, Anderson of New Orleans, Fleming of San Francisco, Fincher of Atlanta, Bailey's associate in Chicago. I'm sure Bailey's associate would be happy to hear himself referred to as Bailey's associate. It happens to be Paul Busey.
Couldn't think of Busey's name.
Now, Lehman, professor of surgery in Virginia, he didn't do neurosurgery actually at this time. L.H.C. Cutler of Cleveland, and I think there's a certain amount of question as to whether he did neurosurgery or not. Gelsma, my associate, Sperling. Is Sperling, thank you. Van Wagenen and Sperling.
But
Now-
you were too young to get on that list. Those are fellows that were contemporaries of
That's right.
Sperling and everything.
Now, the next short paragraph said, undoubtedly there are others whom I do not know. For instance, I understand that McLean is to start practicing neurosurgery in Portland, and that's Portland, Maine. Also Crawford at the Ford Hospital in Detroit. It seems to me, if we should decide that such a move was desirable, it would be well to select about 4 men beside ourselves to approach, and should they be enthusiastic about the proposition, perhaps the 6 of us could meet and make some preliminary plans for organization. 4 men, which I had in mind, would be Sims of Memphis, who was a classmate and personal friend of Dandy, and Dandy could be approached through him. Temple Fay of Philadelphia, Tracy Putnam, and Gardner of Cleveland. I think any preliminary plans that we might have should be kept absolutely secret. I think this is kind of an important idea. It's going to be secret. Sort of like Bones, the secret society.
Yeah.
Incidentally, there's a certificate of Harvey Cushing as a member of Scroll and Key in there.
Oh, in the library, yeah.
Yes. Because if we decide to go ahead with this thing, we want to be able to approach these desirable men before the Society of Neurological Surgeons had an opportunity to counteract the move. See, there's a little bit of competition going on already, and this is the first letter.
Very good.
I am not sure, but what they would be relieved to have another society formed. Get rid of all the ones they didn't want, I guess. Inasmuch as it is probably very embarrassing to them not to be able to take in men who have the proper qualities to belong. I think if we could get this group of men together on the proposition, we would have a real society. I think if Dandy were properly approached, he would probably be willing to back up such a move. After all, he would be a great asset to the organization. Let me hear from you right away in regard to this proposition. With kindest regards, I am very sincerely yours, R. Glenn Sperling, M.D. Now, I might just conclude by saying, to my knowledge, there is no letter in our files transmitted to Dandy, and no letter in response to such a letter. Although I suspect that his former classmate at Missouri, at his Sims, must have written a letter to him. And that may be something we should look for in his part of this audiovisual affair that's starting right now.
Okay.
I think so. Most of the approaches to Dandy, judging from these letters, were on a personal and verbal basis.
Yeah.
Now, there may have been a letter from Sams because they kind of expected him to approach Dandy.
Well, do you have an answer to that letter that Sperling wrote to?
Yes, Dr. Van Wagenen wrote back very, very promptly. His letter is dated June 30, 1931, and said, I was delighted to get your letter. Please put me down near the head of the list as being in favor of the forming of this society that you speak of. I would also add to the list Dr. Cyril Courville, who is working with Town in Los Angeles, and also Busey, unless he is already in the other society. It seems to me that there is a very definite need of such a group as you suggest, and I think we might make a good thing of it. It would probably, or undoubtedly, take the props out from the from under the existing society, but who cares about that? I would be very much in favor of not making it a stepping stone for the old society. I have an idea that we could bid for new members as time went on about as well as they. P.S. also to the list, as to the list also, Leo Davidoff of New York. It's been interesting to see the tone of these various letters. Of the four men who met ultimately to form the society and set some principles down for the society, they met on October 10, 1931. It seemed to me that each had an entirely different style. And of the four, I felt that Dr. Temple Fay, who was not always mentioned kindly in these letters, probably had the best command of the English language, had his thoughts put together better than anyone else, and offered some very constructive points of information. I just wonder if I should kind of briefly go over his reply to this very same letter, because this identical letter was sent to several people, to Van Wagenen, to Semmes, and to Temple Fay, and to Tracy Putnam.
Yes, I think so. I think it was, they appreciated what you have said, I think, about Temple Fay, because after their original meeting, they asked Temple Fay, well, as a matter of fact, he brought up the problem, and they asked him if he would write the Constitution and bylaws, which he did.
Mm-hmm. And he wrote it very well. And I don't have a copy of it. I don't know where it is. Either of you have a copy of this?
I have a photostatic copy of the original draft, which is in these archives, and then it has all of the corrections on it. And then there's a copy of the final form, and they're in the archive.
Well, let's hear Temple Fay's letter.
Yes.
I will try to skip it because skip over some of the parts that are not too pertinent. It's a two-page letter, and he said, "I've talked this matter over with several in the past, and they also have agreed as to the desirability and possibility of such a group. You have made the first objective move in this direction, and I am heartily in accord with your views."
Excuse me. Before you go on, would you like me to identify Temple Fay as to who he is?
Oh,
We
certainly would appreciate
Yes.
your identifying him because...
well, he was a middle-age neurosurgeon at University of Pennsylvania and also at Temple University, where he threw most of his weight in later years. But he had been associated with Fraser for quite a long while prior to that. And we had a meeting of the Harvey Cushing Society down there in Philadelphia, and I remember it was just delightful. They did everything, including eating goldfish.
Well, I guess he's quite a character.
Yes.
I had him examine me on the American board, and they told me that if you make a few remarks and lead him into some of his favorite topics, that he will do all the talking. In fact, I think he asked me one question and did the rest of the talking while I was examining me. I felt very relieved.
Well, apparently the other men, his contemporaries at this time, must have thought of him just as you expressed, because they speak of him as being a reactionary spirit among neurosurgeons with a lot of ideas. Now,
You want to name him? The reactionary spirit?
Temple Fay.
I see, yes. I thought you were going to mention
No.
Chubby Grant.
No.
There's another.
Yeah, that's another character.
He goes on to say, "I'm distinctly of the feeling that if this society is organized, certain fundamental principles should be established to avoid some of the difficulties encountered in the older society. I would far rather see a group of younger men organized to meet regularly in a round-table discussion of problems confronting the neurosurgeon with a definite program assigned, similar to that carried on in the Association for Research in Nervous and Mental Diseases, than to gather each year at some clinic to see the host strut his stuff to the envy or unfair criticism of those attending the meeting. I've felt that such a society would have its own place irrespective of the older men and would contribute more in the end if many of its members were assigned 1 year in advance portions of the problem that required unbiased and fair analysis. Such a meeting could make a joint report after it had heard the evidence from all sides, which would clarify many of the disputed points now under consideration and advance in an orderly manner toward constructive additions to our neurosurgical knowledge. Temple Fay continued, where formerly individual clinics possessing extensive research possibilities have dominated the meetings, there would arise from such a program a mutual addition to our knowledge representing the possibilities of each member to carry on research under his particular opportunities. Then I'll skip a few sentences. The most important phase of our problem rotates around investigation and advancement in the fields of neurosurgery, with the fundamental needs of establishing methods of early diagnosis and postoperative treatment directed toward the protection of the patient and a decrease in mortality. Such a program could be undertaken with a clinic as a minor factor. Goes on to say, with the dedication of the younger society's activities toward the advancement of research problems, there would be no reason to confuse the two groups. I have heard some discussion by members of the older society along the lines of fostering the younger group with the idea of gradual inclusion of certain members into the older society as their prominence and qualifications seem to warrant. I, for one, feel that such an idea is unfair to the younger group and would only tend to promote ill feeling and permit personalities and political interests to disrupt this program. If such a younger group is to be organized, let them do so independently, fearlessly, and without a feeling of rancor toward the older group, as there's no doubt about the fact that the difficulties confronting the older group have been mainly due to their type of meeting and the small possibilities for entertainment by means of neurosurgical clinics, etc. The rest of the letter is just a matter of formalities.
Well, I think it would be very interesting to follow this on as he did it. He approached Dr. Tracy Putnam a little differently. And Dr. Putnam wasn't as accepting to this new idea as the others were. And what he said to Tracy Putnam, well, he said, the motives that prompted me to undertake the organization...
Identify the writer.
This is Dr. Sperling.
Sperling, right.
Dr. Sperling to Tracy Putnam.
Yes.
At Boston. And he said, the motives that prompted me to undertake the organization of the society were wholly unselfish and in no way related to pique at not being elected to the older society. There are between 20 and 30 young men doing neurosurgery exclusively in the country who don't have the advantage and privilege of attending meetings where neurosurgery is the chief topic of discussion, and furthermore, they will not perhaps for years have the opportunity to attend such a meeting, such as he wrote in the other letter. And he said that there should be provisions for this group of men to have another organization. And he said the only other possibility that I see would be for the older group to organize a junior society to which these men would be invited to belong, and perhaps the yearly meeting of one of the larger clinics. The older society thus far has taken no steps in this direction and have apparently ignored this group of men. Furthermore, the older society has been quite a clannish affair in that the satellite of 2 or 3 different clinics have been rushed in ahead of other men with clinics of their own. It had not been my idea that the membership in one society should preclude the membership in the other. About 3 years ago, Addison talked with me about the advisability of forming another society. He felt that the older group were not doing the proper thing by the younger men and offered in a way to assist in the organization, and he also talked to Sims along this line. And I know that Penfield was in the process of forming an organization like the one we have in mind when he was elected to the older society. And then, of course, he dropped it. It seems to me that if we follow the same course as Penfield, the principles for which we started will continue to be defeated. And I, for one, have thoroughly decided that if the organization of this group precludes my membership in the other, I am willing to give up that privilege in order to further the needs of neurosurgery. And this is, but Tracy Putnam was not wholly convinced, and he had kind of a chilling response to the letter. He said, I'm not wholly convinced. And he said, I understand there's a party within the present society which would be glad to see it enlarged considerably. Of course, I suppose in the senior society there were many ideas on which way it should go.
Dowman was very liberal in that respect.
Dr. Dowman of
Yes.
Atlanta, yes.
This is Dowman Sr., who is the father of the present Dr. Dowman, also a neurosurgeon in Atlanta. His father is dead many years ago, God bless his soul. He was such a fine gentleman. He used to open the non-business portion of the meeting by standing up, this is the senior society so-called, and raising his glass and saying, Dr. Cushing, I'd like to drink your health. He was really a...
Well, Tracy Putnam said, in another 5 years, of course, matters may be different, but by that time, the old society may have changed its point of view. And he says, after all, meetings scattered over the continent are time-consuming and expensive, and if you have 2 organizations to go to, it might be quite expensive. He said, of course, I do not mean that I'm wholly content with the way things are going in the older society. See, Putnam kind of pulled his punches. He was kind of waiting to be invited into the senior society and hoped the door would be open. He wanted to keep that door open. And he said that you could be invited to the senior society. And Sperling wrote right back and he said, it may be true that visitors are welcome to the meetings of the older group, but I have been a visitor now for the past 5 years, missing only a few of the meetings due to the kindness of my friends in inviting me. At these meetings, there have never been more than 2 or 3 guests. Furthermore, those who are desirous of obtaining the benefit of a society meeting of this type get self-conscious about continually being a guest. Mm-hmm. And I know several men who have declined invitations because of this embarrassment. And I see no reason why there should grow up an antagonism between the 2 groups. Now, do I see why membership in one should preclude membership in the other? And then, you know, as a result of these, the organizational meeting was held in Washington, D.C. on October 10th of 1931. And present were Glenn Sperling, Eustace Sims, Temple Fay, and William Van Wagenen. Putnam was invited, but as others expected, he didn't show up. And they drew up a list of 35 potential members, only half of whom were neurosurgeons. And Bailey and Adson both felt that this was a mistake, bringing in these outsiders of neurosurgery. But they replied, well, we want to have the entire field covered, neurology, neuroradiology, neurophysiology, everything, and so bring these people in. Would it be proper if we read the record of this organizational meeting?
I think quite, yes.
Well, this meeting held at the Hotel Raleigh. Dr. Glenn Sperling, and these came from the archives. Dr. Glenn Sperling, Eustace Sims, Temple Fay, and William P. Van Wagenen met for the purpose of considering the advisability of forming a new society for the purpose of study, advancement, and correlation of subjects relating to organic neurology, such subjects being neurosurgery, medical neurology as practiced today, neurophysiology, neuropathology, and röntgenology. In general, it was thought worthwhile and advisable to form such a society, and a list of names was suggested and temporarily acted upon as men to whom invitations would be sent. It was also thought advisable to consider the forming of a central library for filing and interpretation of sections of brain tumors of unusual interest. Now, that was the start of the tumor registry, right? That
Right,
in mind.
yes, by Louise Eisenhart.
Yes. In order that there should be, that there could not be any confusion of the aims of this society with that of the existing neurosurgical society, it was thought advisable to consult with Dr. Cushing, who is the founder of the present neurosurgical society, and with Dr. Coleman, who is the president of that society this year. And Dr. Sperling was to see Dr. Coleman, and Dr. Van Wagenen was to see Dr. Cushing. And the various names were suggested for the society, which are Cushing Society, Cushing Research Society, Cushing Neurosurgical Society, Cushing Society for the Study and Advancement of Organic Neurology, Cushing Society for Organic Neurology, Cushing Roundtable of Organic Neurology. The only common word in the whole thing, obviously, is Cushing.
Yeah.
And I wondered how this would go along with people that hadn't worked with Dr. Cushing, and if they would go along with it. But it was decided that the society might have one meeting a year, be limited to 3 days, which has gone on through the years, that the first day should be in the hands of the man in whose clinic the meeting was held, and that the next 2 days should be given over to the discussion of work of the individual members, and that the policy of inviting guests outside of the society for the presentation of the papers might well be adhered to, which goes on today. It was also thought that an advisable policy might be to apportion research problems among various clinics with a time limit of 2 years or so to report on them. It was also decided that membership in general should be a fairly wide one, and that as time goes on, younger men might gain admission to the society either by invitation of the society or through the filing of application, which of course would be acted upon by an executive committee, William P. Van Wagner, MD. And these concepts really were carried on down through the years.
Yes.
And that was the minutes of this first organizational meeting.
The first meeting of the Harvey Cushing Society was held in Boston at the invitation of Dr. Cushing. It was held on May 6th and 7th, 1932.
That's right.
And the official copy of the minutes indicates the names of the men who were present. And the first event was an operative clinic by Harvey Cushing at the Peter Brent Brigham Hospital at 10:30 a.m. And then the society adjourned to Vanderbilt Hall for lunch for the full price of $1. They gathered again in the amphitheater of the contagious building of the Children's Hospital at 2:30, and a series of papers were presented, and Dr. Putnam presided. They had to do with injuries of the spinal cord, cerebral edema, brachial palsy, diseases of the nervous system treated by hyperthermia. And they had their first executive session at 5 o'clock at the conclusion of the scientific session, so that first meeting wasn't much different from the current meetings. And Dr. Van Wagenen was elected as the first president, Dr. Putnam secretary and treasurer, and Dr. Sperling vice president. Dr. Fay was elected to the executive committee for 2 years, and Dr. John Fulton for 1 year. By a unanimous vote, the name of the Harvey Cushing Society was chosen. The executive session was then adjourned until the following morning. And then they had dinner at Longwood Towers. I believe the cost was all of $2.75. The following day, there was another clinic by Dr. Harvey Cushing in which he presented 18 patients, most of them operated upon within the last 2 weeks. They met again Saturday morning, May 7th, the neurological unit of the Boston City Hospital. And a series of papers were presented. Sites of predilection for gliomas of different cytology, some aspects of local allergic phenomena in the brain by Dr. Davidoff, representation of the tail in the cerebral cortex of primates. Another title I saw for that, which was presented by Dr. John Fulton, is How the Monkey Wags His Tail. And lumbar sympathectomy in the treatment of megacolon by Eustace Sams. There are other papers. But those were the minutes of the first meeting.
Okay. About 10 days after the series of meetings that Dr. Davy just described, there arrived at Dr. Tracy Putnam's desk a letter from Harvey Cushing, Peter Bent Brigham Hospital, 721 Huntington Avenue, Boston, 17, Mass. Date, June 15th, 1932. Dear Tracy, thanks much for your note and for the photograph of the newborn club. They look like a very serious and hard-working group, all except the 3 squatting figures in the center of the picture. But if you had only been sitting where John is, John is John Fulton, which is in the center. Where is he?
Right there.
I'm sure
Right
we'll have a
here.
blow-up of that. Yeah.
Yes. You might possibly have cooked up as coy a smile as he has evolved. The important part of this letter, I think, comes in this last paragraph. And it goes as follows. I am very proud of you all, and that I should have been immortalized by having you use my name is a source of pride and gratification. Always affectionately yours, H.C. Now, just off the side in relation to this letter, I would like to add that some 10 or more years after this 1932 that we've been talking about, there was a move on to change the name of the Harvey Cushing Society to a somewhat less, I don't know what personal name, yes. And it was finally selected that it might be the American Society for Neurological Surgery, I think. Is that the present title? It matters not, but you will all have a chance to find out the title in your program. Now, had I known of this move to change the name of the society, and had I known of this letter that I have just read to you, I think I would have read this at that particular meeting when the name was changed, and in that case, it is quite possible that we would still be the Harvey Cushing Society.